Hi, my name is Drake. I'm a DNP student, and I'm going to be talking about some certain tests or specific tests you can do for shoulder injuries. So first, though, when you come in and you're looking at the patient, you probably want to look, just at the shoulder to see if you see any swelling or deformities. So you just want to inspect it, and then you want to palpate it and just kind of palpate around the joint and make sure that and see if there's any specific tenderness spots, or if they're feeling any pain, or if you feel any deformities when you're feeling around the shoulder. And then you want to have them perform like range of motion. So you'll have them like lift their arms all the way up, you'll have them put them down, they can lift to the side, and if that elicits any pain, that could indicate a shoulder injury. And then, so one of the tests you can do is called a cross arm test, and so you just cross your arm over your body, and if they have any pain, it could indicate an injury or disorder of the acromioclavicular joint, and they may possibly have like arthritis. You can put your arm down. Another test you can do, this would be for rotator cuff injuries. You will lift both your arms up and put your thumbs up, and I want you to press up against me. And if that elicits any pain, that could indicate a supraspinatus injury, like part of the rotator cuff. And then you want to have them place their thumbs down, and that's called the empty can test. So put your thumbs down and then press up. And again, that could indicate a rotator cuff injury or injury to the supraspinatus. Another test you can do to rule out rotator cuff injury is called the Apley scratch test, and you just have them put their arm behind their back, or back like this, and then you want to have them reach over their shoulder too, and they can do it on both, but just depending on whichever they're complaining about pain. So if they're having any pain, that can indicate a rotator cuff injury as well. And then also another thing, put your arms straight out, and then you lift their arms up, and then you're holding their arms and you'll let go. And if their arms drop straight to the side, that's called the drop arm test. And if it's positive, that could indicate a rotator cuff tear. And those are just some tests that could rule out shoulder injuries.